Welcome back. Throughout the month of February, health professionals prioritize cardiovascular health with American Heart Month. The American Heart Association is just one of many organizations aimed towards promoting healthy heart habits. Here to discuss what you can do to have a healthier heart is a cardiologist volunteer with the American Heart Association and the next director of the Women's Heart Program at Weill Cornell Medicine, Dr. Nupoor Narula. Doctor, thank you so much for joining me.
Thanks so much for having me.
Now, can you just tell us a little bit more about the mission and effort of the American Heart Association?
Yeah, absolutely. So, the mission of the American Heart Association is really to build healthier lives free of cardiovascular disease and stroke. So, we know that heart disease is the number one killer both in the United States and worldwide. And the impact of the American Heart Association truly has been tremendous. So, to accomplish its mission, the American Heart Association focuses on education through evidence based scientific recommendations regarding healthy lifestyle choices and surrounding CPR. The other pillar of the American Heart Association really is advocacy in order to enhance the health of our community.
Now, what are some of the ways the AHA promotes behavior that supports a healthier heart?
Yeah, that's a great question. So every year during American Heart Month, we elevate the awareness of heart disease overall and in women specifically through media campaigns and events. And throughout the year, we partner with communities, businesses, schools, places of worship, you really name it, to bring our heart healthy message to as many people as possible and attempt to meet people where they live, where they work, where they enjoy.
Now, the American Heart Association's Go Red for Women movement will continue to fight against heart disease and stroke within women. Can you speak more to why, there's a need to focus on stroke within women?
Of course. So, worldwide, stroke is the second most common cause of death, and the risk of stroke over a lifetime is higher in women as compared to men. In addition, we know that women suffer from worse outcomes after stroke compared to men. And as a result, we need to focus on stroke in women. The first step is to really understand the signs of stroke. So, I'd like everybody to remember the word fast. So, F stands for face, is it drooping? A stands for arms, can you raise both? S stands for speech, is it jumbled or garbled? And T stands for time, we should be calling 911 right away. The other thing to keep in mind that's unique for women is that there are periods in a woman's life when she has an elevated risk for stroke, for example, during pregnancy, menopause, or when she's older. And there are also certain medications which can increase the risk of stroke in women.
Thank you so much for, pointing that out because prior to this, I didn't know, there was that much of a difference, which leads to my next question. Can you just tell us, how, heart issues, specifically, I guess, a heart attack differ between men and women?
Yeah, this is a really important question. So thank you for asking this. We know that women with more heart attack can have different symptoms and presentations as compared to men. Men most often report chest pressure, and women may also often report chest pressure, but they're also more likely to have nausea, vomiting, neck and jaw pain, back and abdominal pain. Women who have a major heart attack are relatively more likely to have what we call cardiogenic shock, which is a condition in which the heart is not able to pump enough blood or oxygen to the organs of the body that it needs. Women are also less likely to have bystander CPR in an out of hospital cardiac arrest.
Wow, I appreciate you taking the time just to, explain that because I think when people often hear heart attack, we just all assume that everybody experiences the same thing. And so it's so important to, highlight that it's not the same for everyone. So thank you for that. Now, the American Heart Association is also challenging people to a CPR challenge known as Be the Beat. What is this challenge all about?
Yeah, absolutely. So, CPR is the focus of Go Red 2023 because approximately 350,000 out of hospital cardiac arrests occur each year in our country. And out of that number, close to 90% of them are fatal. We also know that women and people of color are less likely to receive CPR when an emergency occurs. Now, CPR can at least double a person's chance of living if they have a cardiac arrest. And this is really because chest compressions act to pump blood and therefore oxygen to our body. So I would really recommend, that we all learn CPR. Generally speaking, its steps include one, we call it 911 right away. And two, we should be pushing hard and fast in the center of the chest. And the goal is that at least one person from every home or household knows how to perform CPR so we can save a life.
And I think that's so amazing. And it's unfortunate a lot of people don't think about it because, I guess everyone thinks that it's not something that they'll experience, but you just never know. Can you just quickly let us know if somebody is interested in learning, about CPR, where can they go? Or like, is that something that they can just YouTube? What is the proper steps to make sure that they are qualified or, and certified to, do CPR?
Yeah, absolutely. So this is a great question. One of the websites that they can visit is heart.org. It's the American Heart Association website. And all of the steps will be listed for you in terms of how to perform CPR, how to perform it adequately.
Right, thank you so much for that. Now, the American Heart Association is also trying to help make the Bronx healthier with their Building a Healthier Bronx CPR in School programs. Can you just tell us more about the need to bringing this to the Bronx specifically?
Yeah, so the American Heart Association has teamed up with David Potak, who's the president of Unitex Textile Services, to create a Bronx-based program which is aimed at providing 20,000 middle and high school students and their families with CPR and first aid training over the next 3 years. And this will further help to meet New York State Education Department requirements for high school graduation. Now, this program is working with 16 schools to place reusable CPR training kits along with resources in multiple languages, including Spanish. And I think that this is extremely critical in a diverse community like the Bronx because research does indicate that Latinos and African Americans are 30% less likely to have CPR performed by a bystander.
I think that's really surprising info. It's not something that I knew before. So, I
Mhm.
appreciate you talking about that a little bit more and just talking about the severity that, that it could lead to. So I appreciate that. Also like that, it's being taught in schools and that, we're extending health, to children. Can you just talk a little bit about why that's important?
Yeah, absolutely. Overall, the vast majority of children are actually born with excellent cardiovascular health. And what we've seen is that over time, this cardiovascular health can decrease. And as a result, it's really important for us to model behaviors that we know will benefit our kids as they grow up.
Now, as you mentioned, Black and Latinos are less likely to receive CPR. I think that information is also very, just shocking when we hear, according to the CDC, that Black adults ages 35 to 54 are more at risk for heart diseases. Can you just explain why that is?
Yeah, absolutely. So risk factors for heart disease, such as high blood pressure, diabetes, obesity, sleep disorder, are common in Black adults, and this is even at a young age. So, Black adults have more exposure to certain chronic stressors, which can function as barriers to getting very good quality health care. And data have also shown that there are social and economic barriers to high quality health care, cost barriers, a higher uninsured rate. Young Black adults may also have decreased access to nutritional foods in the neighborhood, decreased physical activity, less frequent yearly checkups, and therefore inadequate screening protocols.
Now, other medical conditions like diabetes and other conditions can actually put people at higher risk for heart disease. Can you just expand on that a little bit?
Yeah, sure. So, diabetes is actually associated with around a twofold higher risk of heart disease, and therefore we need to treat it for full force. So, the best way that I would think about this is if we have too much blood sugar that's not kept in check, it can damage the arteries and organs of the body. So, in addition to leading to black buildup in the heart arteries, it can also lead to stroke, peripheral artery disease, which is disease in the arteries of the legs. It can lead to kidney disease. High blood sugar levels can damage the blood vessels of the eye. That can lead to glaucoma. It can even lead to blindness. And it's also important to note that people who have diabetes may be more likely to have other risk factors for heart disease, such as obesity, higher cholesterol, high blood pressure. And, just here, I do want to put in a plug for high blood pressure because it's actually what we call the silent killer because oftentimes there are no obvious symptoms of high blood pressure until you're, farther down along the course.
Now, what can people do just to ensure that they're taking better care of their heart and just reducing their chance of heart disease?
This is a great question. I think that one of the first steps is really to understand what the American Heart Association calls the quote prescription for health through their life's essential eight. And these really include the most important predictors of heart health and detailed information on how we tackle each one of them and in a really systematic way. So these eight important components include don't smoke, eating better, getting active, losing weight, managing blood pressure, managing cholesterol, managing blood sugar, and now healthy sleep is the newest essential step. I think we also need to encourage routine wellness visits with healthcare providers for screening, for heart disease prevention, and so that we know our numbers. What is our weight? What is our blood pressure? What is our cholesterol? What is our blood glucose levels? We also need to increase education in our children for healthy habits and physical activities so that this may benefit them long term. And I think the other important aspect is really that we need further research and advocacy in order to close that gap in racial, ethnic, and sex specific differences in heart disease risk.
Now, you briefly mentioned children again. I wanted to just talk about them as well, because I think oftentimes when we talk about these things, we often associate them with older adults, which could, be a valid reason. But, what are some ways that a child or a teen's cardiovascular health is threatened?
Most kids are really born with excellent cardiovascular health. And over time, these heart healthy habits can decrease. And I think it highlights a hope to model health behaviors at a young age within family and community structures. So, what are the ways, a child or an adolescent's health can be affected? There's certain metrics again. Smoking is one. So, we say don't smoke. Healthy diet, physical activity level is another one. We want to encourage children to stay healthy. It facilitates bone health, brain function, attention, and it can also help with other things, managing weight and cholesterol, managing blood glucose levels, managing blood pressure.
And I also think that it's important going back to, the school program that we introduce that to kids at an earlier age to hopefully prevent them, from getting these issues as they get older.
Agree with you completely, Kevin.
Now, I want to talk a little bit about the screening opportunities or just resources the American Heart Association has, just so people can have other options when it comes to, protecting their health.
Yeah. So, the American Heart Association has incredible free resources. As we talked about, high blood pressure can go undetected for long periods of time. So, the American Heart Association, for example, has information about what constitutes high blood pressure, how to take your blood pressure. It also has resources of when screening is recommended. For example, discussion surrounding smoking, physical activity, diet is recommended at each visit that we go to. A weight check is recommended at each visit we go to. If you have a community event or a health fair with screening, there are health fair resources and materials the American Heart Association has in both English and Spanish, for example. And I'd also encourage everyone to check out the kids' health initiatives that are present on the American Heart Association site for elementary school students, for middle and high school students, to really encourage students, schools, administrators, families to really get active.
All right, Dr. Narula, thank you so much for joining us and having this really important discussion.
Thank you so much for having me. It's a pleasure.
To stay updated with all the efforts of the American Heart Association, please go to their website at www.heart.org or follow them on social media at American_Heart. We have to take a quick break, but we'll be right back with more Open right after this.